neonates, like when you say septicemia as a diagnosis, what are the things that come to mind? What would be the feature in a patient with septicemia?
Fever, shock like symptoms.
Okay, fever, right? How much should be the fever? How much is the fever generally with septicemia?
It should be like high grade fever, ma'am. About 1 or 2 like that.
Right. So generally in adults, in septicemia, the temperature would be very high. Whereas in neonates, the septicemia, the fever is not generally very high. You will get septicemia with very low grade fever. Why is that? What does fever indicate? Why does the body produce fever?
Reaction. Susceptibility.
Reaction. Sorry, reaction to?
Reaction
Fever
of.
is indicative of the fight between your body's susceptibility and the organism, right?
Yes, ma'am.
If the organism is more strong or the fight is more stronger, then the fever will be high. So that is why in septicemia we would expect ideally for the temperature to be very high. But in neonates, the immunity is hardly developed, right? So that is why you would not get the classical features of septicemia in a neonate as we get in adults, right? So if you see ki temperature is only 99, you should not rule out saying ki no, this is not going to be septicemia or this is not going to be a grave infection, because in neonate many of the times we have seen that the temperature is not necessarily high even in cases of septicemia.